Hi, I am Dr. Bharath, Senior Consultant Cosmetic and Plastic Surgeon at Manipal Hospital's Sarjapur Road. During COVID and post-COVID, we have seen an increase in the number of children sustaining burn injuries. And this mostly is due to the children having upper respiratory tract infections and they are advised steam inhalations. And during when they take these steam inhalations with the hot water, they accidentally spill the hot water onto themselves and then sustain these burn injuries. And these burn injuries are called as scalds. So the most important first aid to be done at home after sustaining a burn injury is to wash it with cold water, running cold water for at least about 5 minutes, which is the only important thing which has to be done. We often get patients who use all other kinds of things like the ink or even a banana peel or a papaya peel or even a toothpaste is being smeared onto the burn wounds and they end up in the OPD with these injuries. And all these things are preferably to be avoided. They are not to be used in the burns. So the only most important first aid to be done is to wash it with cold water, cover it with a clean cloth and then bring them to the emergency. It is very important that you consult a plastic surgeon on an emergency basis. This mainly is because the plastic surgeon will be able to determine the extent of the burn injury and the degree, the depth of the burn injury. We all know that the skin has 2 layers and depending on the temperature of the hot water or whatever the hot material that is, the depth of the burn varies in each patient. So it's very important to determine what the depth is on day 0, which will further determine what further treatment needs to be given. In case of superficial burns, which is involving only the top layers of the skin, generally what is advised is daily dressings on the outpatient basis and also an adequate diet and oral fluid intake for the child. This is what is sufficient, and the superficial burn injuries heal in about 7 to 10 days. In case of deep burn injuries, the child may have to be admitted and they might need further procedures in terms of excision of the deep burns and skin grafts. This will ensure that the burn wounds heal very well and in a quick time so that the child can recover better. After all these procedures are done and once the burns have healed, it is very important to stay in proper follow-ups with the plastic surgeon who can take care of the scars further. There are certain measures used to reduce the scarring in the burns patients, like we might use some scar ointments, or we also sometimes use compression garments in order to reduce the scarring.